Welcome to Pediatric Advice Hub. Autism is a neurodevelopmental condition that affects communication, social interaction, and sensory processing. It's called a spectrum because every child with autism is unique, with varying strengths and challenges. Autism begins before birth and is not caused by vaccines or parenting. Signs can appear in infancy, but many children are diagnosed later, often in school. Children with autism may avoid eye contact, struggle with emotions, or have intense interests, but they also possess incredible strengths like high memory skills and unique problem-solving abilities. In a typically developing infant, certain social and communication behaviors appear naturally by the end of the first year. Responding to their name, making eye contact, smiling socially, using gestures, and imitating sounds. Missing these actions may indicate early signs of autism. Some early red flags in infants and toddlers include lack of eye contact, not turning toward voices, absence of social smiling by 6 months, and no babbling by 12 months. These signs are worth monitoring and discussing with your pediatrician. Parents often notice differences first. They might say things like, "He doesn't look at me when I call his name," or "She doesn't show me toys." These observations can reflect delays in social communication, joint attention. This skill is not just about looking, it's the cornerstone of language, relationships, and learning. When it's absent, it can be one of the first signs professionals look for when screening for autism. Joint attention is the ability to share focus with someone else on the same object or event. It typically starts around 9 months and becomes clearer by 12 to 15 months. For instance, your baby might see a dog, look at you, and then back at the dog. This back and forth interaction is vital for future skills like language and empathy. Joint attention is essential for development because it teaches children to follow others' focus, helping them learn new words and understand that others have thoughts and feelings. In children with autism, this skill may be delayed or absent, making it harder for them to engage socially. The good news is that joint attention can be encouraged through simple, responsive play. Try naming what your child looks at or using books with big pictures. If you notice a lack of joint attention by 15 months, consult your pediatrician. Nonverbal communication and gestures. While many parents wait for first words, gestures like pointing, waving, nodding, and showing often come first. These are the roots of communication, and when they're missing or delayed, they may be early red flags for autism. Gestures help young children express wants and needs before speech develops, connect socially by showing and sharing attention, and understand and follow what others are doing. Typical gestures that appear before 18 months include reaching for objects, waving hello or goodbye, shaking head no or nodding, pointing with a finger, and bringing toys to share. These nonverbal actions pave the way for language and reflect how well a child is learning to engage with others. Children with autism may show differences in how they use gestures. Common red flags include not pointing by 12 to 15 months, not waving, nodding, or shaking head, not using gestures to show or share experiences, and using a parent's hand as a tool instead of pointing. These signs may seem subtle, but they're meaningful. Parents often describe concerns like, "He doesn't wave, even though we try all the time," or "I noticed he grabs my hand and places it on what he wants, but doesn't look at me." These are very common early signs in children later diagnosed with autism. You can encourage gestures with simple, playful strategies. Use animated facial expressions, point to pictures in books, model gestures, and celebrate when your child imitates. If your child is 15 to 18 months old and not pointing, showing, or waving, talk to your pediatrician. In typical development, babies start babbling by 6-9 months, say their first words by 12-15 months, and combine words around age 2. They use language to get attention, request things, and share interest. Children with autism may have delayed speech, use words in unusual ways, or speak without interaction. Remember, language is about connection, not just words. Common language differences in ASD include echolalia, where children repeat phrases they've heard, scripted speech using memorized lines, advanced vocabulary with limited use, pronoun reversal, an unusual tone or rhythm. These patterns can make communication challenging, even if a child seems verbal. If your child has delayed speech, mainly uses repetition, struggles to ask or answer questions, or doesn't share emotions, it's time to consult a pediatrician or speech-language pathologist. Early support can build vocabulary, improve conversation skills, and foster emotional connections. Developmental regression is when a child loses skills they previously had. This can happen in spoken language, eye contact, gestures like waving or pointing, imitation and social engagement, like responding to their name. The most common age range for regression in autism is between 15 and 30 months. A child who once said mama or waved goodbye may suddenly stop doing so. Regression can look different in every child. Examples include a toddler who used to babble or use simple words suddenly becoming silent, a child who once smiled at familiar faces now avoiding eye contact, or a baby who used to point or bring toys to share no longer doing these things. Parents often say, "She used to talk, but now she's quiet." These changes may occur gradually or suddenly, and they should never be ignored. Regression in autism is not caused by trauma, vaccines, or parenting. It is believed to result from differences in brain development, especially how social and communication circuits mature. Some children regain the lost skills with early intervention, while others may continue to struggle. It's important not to wait and see if you notice skill loss. Bring it to your pediatrician's attention immediately. Tools like the MChat RF or CSBS are designed to catch regression when it happens. Intervention doesn't require a full diagnosis to begin. You can start with speech therapy, occupational therapy, and play-based developmental supports. Both ADHD and autism can look similar at first glance. Trouble sitting still, difficulty following instructions, and being easily distracted are common in both. But the reasons behind these behaviors differ. In ADHD, distractions pull the child away, while in autism, the child may not seek social interaction at all. Signs of social disinterest in autism include avoiding eye contact, not responding to their name, and showing little interest in sharing play. Parents often notice their child doesn't engage with others, which reflects a lack of social motivation, a key trait of autism. Now, several conditions can present similar signs to autism. These include speech or language delays, hearing loss, intellectual disabilities, ADHD, anxiety or trauma, and sensory processing disorders. Each of these can mimic autism but have different underlying causes, making accurate diagnosis vital. Autism is unique due to its specific pattern of differences, persistent challenges in social communication, restricted behaviors, early symptoms, and a functional impact on daily life. It's not just about speech delays, it's about how a child connects and interacts with the world. If you're unsure whether your child's behavior is autism or something else, start by keeping a behavior diary, asking your pediatrician for screenings, and seeking early intervention. Remember, a detailed evaluation can lead to services that help your child thrive. The MChat RF is a free screening tool for children aged 16 to 30 months, used during well child visits to identify potential autism spectrum disorder. Filling out the MCHAT-R is simple and takes about 5 minutes. You'll answer questions about your child's behavior to help your pediatrician understand their development. After scoring, your pediatrician will determine the next steps based on the results. Remember, a positive screen means further evaluation, not a diagnosis. A comprehensive autism evaluation is typically conducted by specialists like developmental behavioral pediatricians, child psychologists, pediatric neurologists, and speech-language pathologists. These professionals are trained to identify developmental delays and behavioral patterns specific to autism spectrum disorder. The evaluation includes several components. A parent interview where you'll discuss developmental milestones and concerns, direct observation of your child using tools like the ADOS-2, cognitive and language testing, and an adaptive behavior assessment to evaluate real-world skills. After the evaluation, you'll receive a written report summarizing the findings. The provider will explain the results and, if autism is diagnosed, recommend a personalized treatment plan. Even if autism is not diagnosed, the evaluation can uncover other developmental needs, providing valuable information to support your child.
Thank you for watching Pediatric Advice Hub. We're here to support you with trusted parenting guidance and child health tips. All our videos are based on recommendations from the American Academy of Pediatrics. This helps you make safe, informed decisions for your child. Please remember, our videos are for educational purposes only. They are not medical advice and do not replace a consultation with your pediatrician. Every child is different, so if you have any concerns, always speak with your child's doctor. Be sure to like, subscribe, and stay tuned for more helpful tips in our upcoming videos.